Functioning of vestibular apparatus, the mode of action of otolith organ. The saccula and utricle provide information about linear acceleration and change in the head position relative to the force of gravity. Saccule responds to vertical acceleration and utricle to horizontal acceleration. The macula of the saccula and utricle are the stretch receptors. When in erect posture, the otolith membranes are so placed that hair cells are least disturbed. Based on the bending of the head, that is sideways or ventro or dorsiflexion, the gravity acts. The hair cells thus deform, with resulting in stimulation of the nerve fibers which lie between them. So this is the hair cells situation when they are resting activity, they are straight, and when there is a change because of the effect of the gravity, the hair cells, they are going to move or they kink, so which are going to cause depolarization whenever the stercocilia move towards the kinocilium, and the inhibition of these cells occurs when opposite thing is going to happen when the stercocilia moves away from the kinocilium. The saccule is stimulated when there is a sideway flexion of the neck, that if the head is tilted to the right, the capilla of the right saccule hang downwards and pulls on its macula, thus maximally stimulated. In left sacculae, there is upward movement of the capilla to produce minimal stimulation. The utricular macula are stimulated when there is a ventro or dorsiflexion of the neck. When head is in erect position, the there is a minimum stimulus to the hair cells, and when head is bent forward or backward, there will be maximal stimulation of these hair cells. For this reason, the macula of sacculae and utricle are called as gravity receptors. The receptors of vestibular apparatus show little or no adaptation. Mode of action of semicircular canals. The semicircular canal detects angular action during rotation of the head along the three perpendicular axes. When the person rotates in clockwise direction, that is the vertical axis, horizontal canal moves in clockwise direction, but there is no corresponding movement of endolymph inside the canal at the beginning of rotation due to the inertia. This phenomena causes a relative displacement of the endolymph in the direction opposite to that of rotation of head. That is, the fluid is pushed in anti-clockwise direction. Thus, in the right semicircular canal, the endolymph flows towards the ampulla, which leads to stimulation, and in the left canal, the fluid moves away from the ampulla, which is going to lead to inhibition by decreasing the impulse discharge. The combination of increased discharge from one ampulla and decreased discharge from the other form the basis of detection of direction of the movement. The movement of endolymph in semicircular canal in turn causes corresponding movement of the gelatinous cupula, causing cilia or hair cells to bend, leading to stimulation of the hair cells. Thus, at the beginning of rotation in clockwise direction around the vertical axis, the hair cells at the ampulla of the horizontal canal in right ear are stimulated, but the hair cells in the horizontal canal of the left ear are not stimulated. Okay, so this is a diagram showing the movement of the endolymph. So when the canals move suddenly, so the fluid in the semicircular canals, they are going to move into the opposite direction and stimulating the hair cells, whereas opposite thing is going to happen in the other ear, where the fluid is going to move away from the hair cells, and which are leading to inhibition, and this differential excitation and inhibition is the basis for detection of the movement. Because of the stimulation of the hair cells in the right horizontal canal and through the sensory nerve fibers to vestibular, cerebellar and reticular centers, now these centers send proper instruction to various muscles of the body to maintain equilibrium of the body during angular acceleration, that is during rotation. On the other hand, rotation in anti-clockwise direction causes stimulation of the hair cells in the ampulla of horizontal canal in left ear only. Adaptation of the receptors in the semicircular canal. During rotation of the hair cells of the crista ampullaris, uh, during the rotation, the hair cells of the crista ampullaris generate impulses, at the rate of 500 to 100, 50 to 100 impulse per minute at rest. At the beginning of the rotation, the discharges increases to 600 to 800 impulses per minute. However, rapid discharges of impulses last only for first 20 to 25 seconds of rotation. Afterwards, during continuous rotation, the frequency of impulses falls back to resting level as endolymph starts moving along with the semicircular canal at the same speed. So this causes adaptation of the hair cells. The important function of these vestibular apparatus is in the regulation of the posture. The tract that sends from the vestibular nuclei into spinal cord maintains the tone in the anti-gravity muscle and coordinates the adjustment made by the limbs and eyes in response to change in the body position. The vestibular apparatus thus play a role in support of head during movement, orientation of the head in space, and in reflexes, that is the tonic labyrinthine and writing reflexes which are accompanying locomotion. That is why vestibular apparatus is sometimes called sense organ of balance or equilibrium. It also helps in the control of the eye movements via its ascending connections to the cranial nerve nuclei. Therefore, in spite of changes in the head position, the eye can remain fixed on the same point through the vestibulo-ocular reflexes. For example, if the head is rotated to the left, the eyes move towards the right in order to prevent an image from moving off the fovea. They also help in orientation in space. Orientation, that is the relative position of the various body parts in space, depends on four inputs, that is from the vestibular receptors, visual information, and by impulses which are coming from proprioceptors in the joint capsule and impulses which are coming from the cutaneous